Have you ever paused to consider how a seemingly small physical restriction, like shoulder stiffness, can utterly reshape someone's entire world?
It's a quiet battle, isn't it?
Yeah, often invisible. Chronic pain slowly stealing independence, making even simple daily tasks feel huge. It's easy to overlook, I think, until you really understand the personal toll.
It truly is. And our mission here is to explore a really quite remarkable story of recovery that sheds light on this very issue.
Okay.
We're going to unpack the journey of a patient, we've changed his name to Mr. Sharma, for privacy, of course, who faced this debilitating shoulder pain and stiffness.
Right.
And crucially, how a pioneering approach helped him, well, reclaim his life.
So we're looking at an account from Dr. Chintan Bhindora. He's an expert physiotherapist based in Pune, right, with clinics in Pimple, Saudagar, and Beener.
That's the one. Dr. Chintan Bhindora shared how an innovative therapy used at his clinic, PhysioZone, made, well, all the difference for Mr. Sharma.
Okay, let's unpack this fascinating account. Let's dive into Mr. Sharma's experience. So, Mr. Sharma, he's a 55-year-old architect, and it wasn't like a sudden accident or injury.
No, not at all. That's often the case with these things. It was this gradual, insidious onset of left shoulder pain and stiffness.
Just creeping up on him.
Exactly. A slow tightening, a creeping loss of function that just got worse day by day. It became this relentless, grinding ache.
Oh, sounds awful.
And that relentless ache, it became his constant companion. His grim reality every single morning. Imagine waking up already in pain, a throbbing pain dictating your whole day.
Yeah.
For Mr. Sharma, things most of us just take for granted became these agonizing struggles. Just reaching up, say, for a cup in a kitchen cabinet, that was a painful and agonizing stretch for him.
Wow.
Getting dressed, especially pulling a shirt over his head, that became such a painful ordeal he often needed help.
So losing independence right there.
Absolutely. And sleep. It offered very little escape. Finding a comfortable position was a nightly battle.
Leading to fatigue, I bet.
Constant, restless nights, perpetual fatigue that just drained him even more.
It sounds absolutely exhausting, not just physically, but emotionally, too. Chronic pain can be so isolating.
Precisely. His hobbies, things he loved, like tending his garden, or playing with his grandkids.
Yeah.
Those became distant memories, replaced by the sense of frustration, helplessness.
And his work as an architect. That requires precision.
Exactly. Precision work, long hours, maybe drafting. It suffered significantly. The constant pain, the limited movement made it nearly impossible to keep up his usual productivity.
So he had to rely on others.
Increasingly reliant on colleagues, yeah. And that really chipped away at his self-esteem. It affected his whole sense of competence, his purpose.
You can see how that spiral happens.
Yeah, the physical limits cast this long shadow over his emotional well-being. Increased irritability, withdrawing from social things. He literally felt trapped in his own body, prisoner of that stiff, painful shoulder.
That paints such a vivid, difficult picture. So, when Dr. Chintan Bhindora first saw him, what was the clinical snapshot? What did the evaluation show?
Dr. Chintan Bhindora's assessment, it revealed a very clear and concerning picture. Mr. Sharma could barely lift his left arm past 110 degrees.
Wow, that's a serious restriction for daily life.
Huge restriction, and any attempt to move past that point met with sharp pain, real resistance in the joint.
And the muscles?
His shoulder muscles, they'd weakened quite a bit, from disuse and also from compensating, moving differently to avoid pain.
Makes sense.
And Dr. Bhindora also noted postural changes, that forward head posture, a rounding of the upper back, classic signs of the body trying to protect the injured area.
But creating new problems elsewhere in the body.
Exactly. New imbalances right up the kinetic chain.
It sounds like a really deeply entrenched problem then.
Yeah.
Affecting more than just the shoulder joint itself. So this is where Dr. Chintan Bhindora introduced something different.
Indeed. At PhysioZone, Dr. Chintan Bhindora's clinic in Pune, they realized Mr. Sharma needed something more than just conventional methods.
Yep.
Their strategy involved integrating something called quantum resonance therapy, or QRT.
QRT?
Yeah, quantum resonance therapy. It's a cutting-edge approach that uses pulsed electromagnetic field therapy, PEMF, combined with Magneto-Mechanical Oscillations.
Okay.
And it's all delivered through a specialized device. It's called the Celtron.
Quantum resonance therapy, QRT.
Yeah.
Using the Celtron device. Sounds very advanced. So for us non-experts, What does this actually mean for someone like Mr. Sharma? How does the Celtron device work? What's the science here?
Right, so QRT, delivered by the Celtron device, it basically works with the body's own electrical and magnetic properties. It's aiming to stimulate healing right down at the cellular level. Think of it as a synergistic approach.
Okay.
Imagine your nerves are just constantly yelling, pain. Well, QRT, through the Celtron, tries to gently turn down that volume.
How does it do that?
It subtly shifts the electrical balance, the potential, across the nerve cell membranes. Makes it harder for them to fire off those pain messages.
So raising the threshold for pain signals.
Exactly. It's called modulating the nerve cell membrane potential. And that's key for breaking that awful pain stiffness cycle.
So it's not just masking pain, it's actually changing how the nerves are firing, sort of recalibrating.
That's a good way to put it. And there's more. The gentle oscillations in the electromagnetic fields from the Celtron also help activate your parasympathetic nervous system.
The rest and digest system.
Right. Shifting you away from that fight or flight stress response that often comes with chronic pain. This deep relaxation is vital. It helps muscles release, reduces pain.
Okay, so calming the nervous system down.
And then there's the PEMF part, the Pulsed Electromagnetic Field therapy from the Celtron. That promotes cellular repair and regeneration. It enhances how cells function, improves circulation, stimulates tissue repair.
Which sounds really beneficial for chronic stuff where there might be tissue damage or inflammation.
Precisely. It's incredibly helpful in those cases. So yeah, it's really a multi-pronged approach to healing, working on nerves, muscles, and cells.
Understanding that foundation, that cellular level approach, really highlights how sophisticated this is. Okay, so let's move from the science bit to the practical application. How did Dr. Chintan Bhindora actually use this for Mr. Sharma? What were the treatment steps?
So Mr. Sharma's treatment with Dr. Chintan Bhindora started with a really focused application. They used the MMO part, the Magneto-Mechanical Oscillator of the Celtron device, first on his neck region.
On the neck, not the shoulder.
On the neck for the first 10 minutes. This was crucial. Dr. Chintan Bhindora understood how interconnected everything is, the kinetic chain. Tension in the neck and upper back massively impacts the shoulder.
Right, it's all linked.
Exactly. So this step helped activate Mr. Sharma's parasympathetic system, allowed those upper body muscles to start relaxing. It laid the groundwork before focusing directly on the shoulder area with the Celtron.
Okay, preparing the area first. Makes sense. And after the neck, where did Dr. Bhindora focus the Celtron device then?
The next 10 minutes were dedicated to the axilla.
The armpit area.
Yeah, the armpit. It's an area that's often overlooked, but it's full of critical nerves, blood vessels, lymphatic pathways, things that can get compressed or restricted with shoulder issues.
Okay.
So the gentle oscillations from the Celtron device there further promoted that deep muscle relaxation, improved local circulation. It was all about preparing the shoulder and the surrounding tissues for more movement, less pain, really setting the stage for progress.
That integrated approach, neck first, then axilla, seems really smart. And the immediate results. Tell us about the impact after just that first session with Dr. Chintan Bhindora and the Celtron therapy.
The transformation was, well, pretty significant, actually, after just that one session.
Yeah.
Mr. Sharma's shoulder range of motion increased by a remarkable 30 degrees. He reached 140 degrees.
30 degrees in one go. That's huge.
It really is. And the excruciating pain, it had noticeably lessened. That stiffness that had basically held him captive started to recede.
Wow.
And this immediate improvement, it wasn't just physical, it gave him this powerful psychological boost, a renewed sense of hope, motivation. It showed him recovery wasn't just a far-off dream, it was actually achievable, thanks to how Dr. Chintan Bhindora applied the Celtron therapy.
That glimmer of hope must have been absolutely crucial. So, did that progress hold? Did the improvements last? Was it just a temporary fix?
Well, encouraged by that initial success with the Celtron device, Dr. Chintan Bhindora immediately added therapeutic exercises.
So combining the therapy with active rehab.
Exactly. Carefully chosen exercises to consolidate those gains, maintain the new range, and start progressively strengthening the shoulder muscles again.
Smart.
And over the next 5 days of continuous treatment, the QRT with Celtron plus the exercises, Mr. Sharma's progress was truly impressive.
How impressive.
He regained full pain-free range of motion, reached a complete 180 degrees in that left shoulder.
Full range, pain-free.
Full range, pain-free. His strength improved dramatically. The flexibility he'd lost was fully restored. The combination, the quantum resonance therapy with the Celtron device and Dr. Chintan Bhindora's expert guidance, it was just a powerful catalyst for his healing.
This is genuinely inspiring. So
Yeah.
outside the clinic, how did this recovery, guided by Dr. Chintan Bhindora, using the Cheltron translate into everyday life for Mr. Sharma, what did his life look like after this amazing change?
Oh, the difference was night and day. His recovery extended far beyond Dr. Chintan Bindora's clinic walls in Pune. Remember him struggling to reach for a cup?
Yeah, the agonizing stretch.
Gone. He could reach overhead with ease again, getting dressed by himself, no problem, pulling a shirt over his head effortlessly.
Film casting.
He started sleeping soundly through the night again, no more battling for a comfortable position. That perpetual fatigue just vanished.
Oh, sleep is everything.
Isn't it? And the joy. The joy of getting back to his garden, tending his plants, actually playing with his grandchildren again, that was just immeasurable for him.
Wonderful. And his work.
His professional life flourished too. He resumed his architectural work with renewed energy, focus, no longer held back by pain or stiffness.
And the posture issues.
Importantly, yes. Those postural abnormalities, the forward head, the rounded upper back, they also began to correct themselves as his overall body mechanics improved. It really shows the holistic impact of the treatment with the Cheltron device.
It's fascinating how the recovery was so much more than just physical, wasn't it?
Yeah.
It really sounds like a holistic transformation of his whole life.
Absolutely.
So if we try and connect this back to the bigger picture,
Yeah.
how does the Cheltron's innovative use of PEMF, the Pulsed Electromagnetic Field therapy, and the MMO Magneto-Mechanical Oscillations, how do they actually facilitate such a profound and seemingly rapid recovery? Can we dig a bit deeper into the science behind it?
Certainly. Let's break it down. PEMF therapy, which is a core part of QRT delivered by the Cheltron, involves applying these specific electromagnetic fields. These fields interact with your body's cells. They influence cellular processes in several helpful ways. First, PEMF significantly reduces inflammation. It modulates those inflammatory pathways, which is vital for pain reduction and letting tissues heal.
Right, tackling inflammation.
Second, it markedly improves circulation. Better blood flow means more essential nutrients and oxygen get to damaged tissues, and waste products get removed faster. That accelerates healing.
Makes sense. Fuels the repair process.
Third, some studies suggest PEMF can actually stimulate bone and cartilage repair, promoting regeneration. That's valuable for joint issues, degeneration, or injury recovery.
Interesting.
And finally, beyond affecting the nerve signals like we discussed, PEMF can also directly modulate how pain is perceived by influencing neurotransmitters and nerve conduction. It sort of helps reset the body's pain response.
So multiple mechanisms working together just from the PEMF component delivered by the Cheltron. It's not just masking pain. It's actively helping the body heal itself and addressing root causes. And what about the other part? The Magneto-Mechanical Oscillations MMO from the Cheltron device. How does that specific element contribute?
Right, the MMO. As it's used in QRT with the Cheltron, this involves applying these precise mechanical vibrations along with magnetic fields. This helps in a few ways.
Yeah.
Tissue mobilization. It helps break down adhesions, maybe scar tissue, improving tissue elasticity and range of motion. That's especially useful in things like frozen shoulder where the joint capsule gets tight.
Loosening things up physically.
Exactly. It also promotes deep muscle relaxation. The gentle vibrations help reduce muscle spasm and tension, working alongside the PEMF effects to calm the nervous system.
So physical and neurological relaxation.
And lastly, these oscillations can stimulate lymphatic drainage. That helps reduce swelling and clear out inflammatory byproducts from the area more efficiently.
Okay, so PEMF and MMO via the Cheltron working together on inflammation, circulation, cell repair, pain signals, tissue mobility, muscle relaxation, and drainage. Quite comprehensive.
It really is. So quantum resonance therapy, as we saw so powerfully in Mr. Sharma's case under Dr. Chintan Bindora's care in Pune, it truly offers a promising step forward in physiotherapy.
Yeah.
Its ability to rapidly reduce pain, improve range, accelerate healing. It makes it an invaluable tool. It allows therapists to move patients more quickly into active rehab, empowering them to take a bigger, more effective role in their own recovery.
Mr. Sharma's journey is such a powerful reminder, isn't it? How innovative therapies like quantum resonance therapy, delivered by devices like the Cheltron and guided by experts like Dr. Chintan Bhindora from Pimple Sadagar and Boehner and Pune, how they can just profoundly impact lives.
It's true.
This really is